All right, welcome back to another PCBH Corner. I'm David, and I'm joined by, someone. I'm trying to think, Jonas, when we even met for the first time. I remember you giving a presentation. It would probably been like 2 years ago during one of the PCBH forums on some of the research that your group was presenting on. I think that was something. Then obviously we've had some other, but I'm really excited for people to get to know Dr. Bromberg about just an incredible human, and an individual that has done a lot of amazing things within the field of psychology and then also within the field of PCBH. And really excited to just have this PCBH corner. So before I start rambling and going off, Jonas, would you want to kind of just give a basic introduction of who you are? And then, as we were talking about before we got on the camera, I always think it's a great thing for people to hear, or at least my mind thinks it's a great thing, people's stories about what got you into integrated care and into the role that you were as and what was the official role with PPOC? It was the director.
As a
What
program director of the
yeah.
Integrated Behavioral Health Program.
And so kind of that story, like how'd you get
Yeah.
there? What was that? So I'll pass it over to you, kind of an intro, and then what was the story that led kind of almost to this point in time right now?
Okay. Well, let me go as far back as my doctoral training, and I had the great fortune to get a really amazing academic advisor who gave me a lot of good advice. He was a health psychologist and really got me inspired about the whole area of health psychology and working at that intersection of mental health and medicine. And that's where I've spent my whole career, at that intersection. I worked for many, I did my training and worked for many years at Boston Children's Hospital. I worked in the pediatric cancer program at Dana-Farber as part of that, and on the bone marrow transplant unit at the hospital. Did a lot of work in behavioral medicine,
Hmm.
taking care of kids with diabetes, juvenile rheumatoid arthritis, migraine headache. So again, leveraging the my expertise in behavioral health and psychology to work with people that had medical concerns as a primary sort of issue. Um, so that's sort of how I got started. And then over time, um, I, I guess the best way, my career has not been a straight line, and all the planning and thought that I could have put into finding a career direction wouldn't have helped me, because the things that led me to the really interesting things that I've done were really just serendipity. I mean, sort of,
Hmm.
following the advice of good mentors, being very open-minded about what I was, the opportunity as I was looking at. Um, and when I was coming out of my postdoctoral fellowship, uh, actually during that time, I worked at the hospital at Boston Children's Hospital in the adult congenital heart program. And
Hmm.
so I was taking care of adults that had, very complex, cardiac, physiology, all sorts of, you know, really challenging medical things. And so I developed a patient support program during that time, during my fellowship, which I continued. I ran a patient support group there for about 15 years after my fellowship ended. But as my fellowship was ending, I had an opportunity. I got introduced to somebody who was starting an interactive health communications business, and nothing I would have ever thought about. Pointing my pointing toward. But I got involved in that, and we created a lot of different kinds of primarily for me, the work I did was primarily patient-facing tools, interactive tools to help people cope with and manage both mental health and medical conditions. I did a lot of work in the pain management area, particularly with migraine headache. Uh, because of my experience in oncology, I did a lot of cancer support programs. So these, we started out, in the age where, interactive CD-ROMs were sort of the thing. And then we did some DVDs, and then we did some websites and, mobile tools. And so we, sort of followed the evolution of the technology with the things that we were building. So again, it was applying psychological science to all these different
Hmm.
sorts of, medical and, mental health concerns that people had. So again, living at that intersection. Um, and I did that for, about 15 years, and it was really exciting.
Wow.
You know, uh, I worked with, graphic designers and video producers, and I was sort of the content and subject matter expert. We put together some really, cool programs that are still out in the world today. And the reach that, those digital technologies had was enormous. I mean, that was really, a really exciting part of it, the reach that we had to really, go beyond what I could have ever hoped to, accomplish seeing people in an office or a clinic type setting. I mean, it was really, really sort of amazing. Um, at some point, about a little over 10 years ago, uh, I had an opportunity come my way back at Boston Children's Hospital in a part of the organization that was the primary care, the affiliated primary care network called the Pediatric Physicians Organization at Children's. And they were, at that time, they were launching integrated behavioral health within that primary care network. It's a network of about approximately 80 independent primary care practices across the state, from the most, western and rural parts of the state to, the urban center around Boston, all over the state. And we started that in 2013, and built the program really from the ground up. It involved three main components. There was an enormous education component. In the early years, that was very focused on teaching medical clinicians, at a much greater depth than they ever had been exposed to, about the etiology of mental health conditions, and how to treat and manage those conditions in a primary care type setting. So we covered things like anxiety, depression, ADHD, conduct and behavior. Substance use became a really important part of our work. In addition to that clinical education, we built a team of clinicians like myself who had a lot of direct clinical experience, and we worked directly with the practices, sort of in a consulting sort of way, to operationalize this, help them hire, help them onboard, and figure out new ways of working together that included having this, new specialist as part of the, primary care team. So there was all that integration support. And then we built various ways to help those clinicians working in primary care get better access to expert consultation, both in terms of psychiatric consultation. And we developed a really wonderful partnership with our adolescent substance use and addiction program at the hospital, the ASAP program, which is led by Dr. Sharon Levy. And we received a couple of grants over the years that helped us develop a program to develop a set of services specifically for primary care. So we created this really unique thing, direct access to adolescent substance use care tailored for the primary care environment. So that was a really exciting piece of the work, and something that has continued, to grow and thrive to this day. So I guess that's my story, David.
Jonas, I have so many different areas of follow-ups for it. And the one thing that, we were kind of joking before this video, and it's kind of coincidental that this is the video after interviewing Chris Hunter, who, Chris Hunter overseeing, the DoD in the vast amount of BHCs there. And as we were talking this year, how many BHCs were essentially in PPOC's network?
It's a little bit over 100 now. Not all of those are full-time clinicians. Not
Right.
every practice, is the size that would support a full-time BHC. But they're, just over 100, probably 110 behavioral health clinicians. And then over the last few years, a lot of teams have added psychiatric nurse practitioners and types of, APRNs with psychiatric specialty. So there are probably about 20 of those in the network, and a handful of psychiatrists as well. So it's really, from the very early days where we started working with 15 practices, where, one of them had a social worker prior to joining the program, and that person was in a much more traditional sort of medical social work role, not doing intervention and working in the way that a BHC does. So it's really grown. It really grew and took on an amazing life. You know?
Yeah, and that's the thing, Jonas. That's and for people watching this right now, like again, to highlight what Jonas said and the amazement of that is that this program started, as we said, in 2013,
Right.
in a 10-year span, in a decade, went from building a program, doing all these different things, and at the end having over 100 BHCs and multiple other specialists. And as you said, not just BHCs, but partnerships with substance use programs and getting this in. What a story, right? Like what an incredible moment and the amount of work that is. So my mind has a lot of different questions I want to ask about that. Now, the one thing though, I wanted to go back to what you were saying at the beginning. You mentioned that one. You said was it an advisor that got you into health psychology? Is that how'd that come about? Like, how did you get hooked up with that advisor? Was that just a random event? Was that something that you were like, hey, I sought this person out? Like, how did that even happen at your beginning of the career to get even involved in the health psychology?
To be honest with you, David, I don't know how I got fortunate to be connected with the advisor I had. I don't know if they, I assume it was a somewhat of a thoughtful process, and I must have expressed some interest in health psychology during my interviews, but I got paired with him, and he remains a important mentor and friend to this day. I mean, more than 30 years later. Really helped me throughout my career. So I think it was just luck. And I would say that, luck and serendipity have shaped my career in so many ways, and just, it's part of the advice I give to, young clinicians when I, have an opportunity to, when people seek my advice and guidance, I just really tell them, be open, be open to whatever, opportunity may present themselves because, something really good may be, there for you that you never even considered. I mean, I had a conversation with somebody yesterday. We're talking about some new endeavors, and it was useful to talk to this person.
Hmm.
Many of the things we discussed were things I had already thought of and people I thought of connecting with. But he had a couple of ideas that were just wonderful that I wouldn't have ever thought about on my own. So,
Hmm.
being open-minded and listening to other people and just seeing where that takes you has really, all the planning, like I said, I mean, all the planning I could have ever done wouldn't have got me to where I was because I would never would have envisioned where I got to.
And that's the thing that I appreciate you saying that so much. And we talked about this even before the video as well. It's like just how much like these things like are accidents, like they're just and to be open to them, to make the most of them. And let me ask you this, you have been, as you said, really in so many different medical arenas, whether that be the oncology, that whether it be working with diabetes, whether it be again developing programs to really try to reach out to people, whether it be CDs or websites, working in primary care. This question might not make sense, so let me know if it doesn't. Is there any components that you've seen when working within each one of those populations that seem to transcend each population? Like, are there any commonalities or any skills or ways of approaching that you think, like, hey, no matter what setting I've in, this has always served me well to approach it this way, or this has always served me well, either in the clinical work or the director work? Any like transcendent things that you've found?
The thing that comes to mind right away in the work that I've done with people and families where somebody's experienced a serious or life-threatening medical issue and any kind of medical issue, migraine, headache, diabetes, um, for the most part, a lot of these people are coming to you, they're mentally healthy,
Hmm.
they're experiencing a period of unusual stress related to the medical condition or medical concern that they're dealing with. So they bring a lot of strength and to the table, and it's really just about helping them adjust and cope with, something that could be quite intense. I mean, working on the bone marrow transplant unit at Children's Hospital, I mean, that was a very intense environment. Kids were very seriously ill. Families were very worried. But you're getting a lot of families that are largely mentally healthy and sort of intact, and they wouldn't encounter a mental health professional if it wasn't for that
Hmm.
medical concern they were having. So I would say that's a thread that cuts through all the the medical related work that I did. I'm trying to think about, as I then shifted more into primary care, behavioral health, where the issues are mental health focused. You're not dealing
Mhm.
with people that are, you may not be dealing with people who have they've been struggling with some mental health concern for a while. Um, what transcends and cuts across that? Um, Probably, the opportunity in primary care, I guess, is really being able to connect with people, join them in their journey, and early on as possible. I mean, primary care offers us an incredible opportunity to really, if these problems are identified, they can be identified like right at the start. And intervened with right at the start, and people don't have to wait till things get worse, or they feel like they're not coping well before they tell somebody. you know we trained our medical clinicians to do routine screening, taught them how to ask better questions and have interviews with people that really elicited this information, and help them convey to the patients that they served that this primary care place, this is some place where you can come and talk about this stuff. We're concerned about your whole person, not just your physical health, but your whole health, and that includes your mental health. And so I would say that's an important part of it is that opportunity to identify and get involved with people, at the earliest point in time when they're struggling with something, and really change the trajectory of it. That they don't have to get worse before you can intervene and get better.
It's
Um,
actually applying, right, like a primary or secondary prevention, right? Like this is
right.
something that maybe we can even prevent something completely, or if something is showing its head, it's like we can, as you, I love how you said we could change the trajectory of what that is going to be within primary care. Ah,
Yeah.
that is.
And as a clinical psychologist, I mean, I was used, when I worked in a purely mental health setting, I was used to encountering people that were coming to me with full-blown problems. I mean, there was no opportunity to get involved early. These were people and families that were really struggling. And, it's amazing. I had the opportunity almost every day to hear stories about families that were helped in ways that might have never it might have taken them months or years to get to that help, but because somebody asked, or somebody took the time to really dig into their record and see that something happened. What kind of a case that comes to mind is, a BHC was reviewing some charts of kids that were coming in, noticed that the family, a parent in the family and a couple of the kids had been involved in a motor vehicle accident. Nobody was hurt, but nobody had attended to that. And the BHC asked the PCP, "Hey, can I jump into and talk with that dad while the family's here?" And she went in, talked with the dad. The dad's like, "Oh my gosh, I'm so glad you asked me about this. We've been so worried about this. I mean, nobody was hurt or anything, but we've been worried about what the kids were thinking and feeling, and we could really use some guidance on how to help them." So that's just that for me. That was just an incredible example of really somebody being very attentive, looking at something and saying, "Hey, maybe I could jump in here and get involved at this very early stage and really do something very quick and easy to help this family." And they met with the parents a couple times, provided a little bit of child development guidance, what to expect, how to talk to kids about these things, and the family was okay.
And you know what's so interesting about that, Jonas? Let me know where your mind goes with this. It's like we've been talking, Bridget and I have been talking about this more about it's so tough um to see it at times, but it truly is life-saving work. Like obviously, again, and you've kind of seen all the whole spectrum of this. Obviously, being in a bone marrow transplant, it's like you can very clearly see how that is life-saving work, right? Like it's immediate. There's an obvious like before and after that's happening, that someone's getting better and it heals from it. That moment though you described with that BHC, who knows how life-saving that was for that family, that, as you said, changed the trajectory and maybe stopped a more insidious process from unfolding within that family. Like that becomes a life-saving intervention. But there's not the immediacy of it, right? There's not like this like immediate kind of response and this obvious intervention that before and after. But that is life-saving work. That is really cool. I love that story.
And somehow it had gotten into the child's chart, so, motor vehicle accident was in there, but nobody had, and nobody got hurt. So I think as a medical clinician thinking, okay, everyone's physically safe, they're good to go, and nobody had really taken time, I think, to ask, how are you all doing with this, what's the fallout from this,
Yeah.
and so this very attentive BHC, saw this, did that, and and the relief that the father expressed, like, right away, oh my gosh, thank you for asking, was, was wonderful. I mean, it was just a great story. And the other, that's that side of it, David. And the other side of it, I mean, part of what we did in the program too, and this was largely connected with our work with the adolescent substance use and addiction program. And you talk about life-saving work. I mean, we did a lot of work training physicians to prescribe Suboxone,
Ugh.
and to intervene with these, really tough opioid use disorders. I mean, that's an example of something way at the other end of the spectrum where people are, experiencing a very life-threatening sort of, behavior, and we can modify that. And we actually had an opportunity to, this was a grant-funded thing. It got a lot of traction in the press. There was a segment on the Today Show done about it many years ago, and it was a young adult patient who, basically said, yeah, this, the fact that my pediatrician was able to talk to me about this and prescribe Suboxone for me saved my life. I wouldn't have gone to a drug treatment program. I would have, abused myself to death. And the fact that I could go to my, my pediatrician, who I'd known since I was a little boy, I trusted him, I knew him well, and could talk to him about this, and he could help me, and it saved my life.
It gives me chills, man. It
Yeah,
gives,
yeah.
again, the power of this work. Let me ask you this, because two questions in my mind has just been kind of going bonkers about. The first one is, you've had such an experienced career of being in so many different areas, as well as like building programs. And again, I still, my mind can't wrap my head around that PPOC 2013 takes on this initiative. By this time it's like over 100 BHCs. Like, what the hell are we talking about? Like, people can only dream of those things. Let me ask you this though, for people out there, because I'm sure you've had emails, I get emails about, hey, we're starting a program, uh, and I don't know what the question. Maybe the question is just like, what would be words of wisdom for people that are beginning this process of starting a program? Maybe it's not ever going to get to like the 100+
Right.
BHCs and stuff, but what advice, what words of wisdom would you give people that are beginning this journey? Maybe that you even thought, hey, I wish I had this advice when I
Yeah.
was starting out on this. Where's your mind go?
I think particularly with folks that have not delved into this world a lot before, and sort of, I guess don't understand, maybe don't have a full or complete understanding of what integrated care could be. Um,
Hmm.
it's some, I guess I would compare it, it's akin to, many people I think start out or think of it as kind of like, parallel play. Like, I'm going to do somebody's going to be working alongside of me, but they're not really going to be intimately connected with what I do. I'm going to have an easy way to sort of get, my patients the help they need, but there's not going to be a lot of deep interaction. And I think the thing that we were able to do, I think the advice that we were able to give a lot of teams, really, this is transformative. We really want you to
Hmm.
think about this as a fundamental change in the way you provide care. This is not something that just gets bolted onto the side. We want this to become an integral part of the way you live and breathe and think day to day as a clinician in your office. That your team has a new capability. You have a expert in an area that we know that you've struggled with for many years. You didn't get a lot of training in medical school about how to handle these things, but don't just think of, don't just do this. It's not just an easier way to sort of pass it downstream. What you really want to do is this. You want to knit it together and
Oh,
develop ways of working and thinking and collaborating that really knit it together as a whole. It's not separate. Again, that idea of integrating it. But I think that means different things to different people. And so when we start talking with groups about how to do this, we really talk about a mind shift, and a this is a transformation in the way you think about and deliver care. I don't know if that it gets at what you were
Jonas,
asking
that
about.
was brilliant, and I don't know if you just came up on that with the spot. And what's interesting, I've never, maybe I have, I just can't remember the word knitting, right? That we're going to knit this together and almost like stitch this together. So it's not just even about like interweaving it. It's like we're literally going to be a part of each other uh, through this. And I love how you also said about like,
Yeah,
and oftentimes this is what integrated care is. It's like, hey, we're just passing it down the stream, right? Like we're taking, hey, you maybe PCPs or the primary care organization, like they know there's a need. So it's like, okay, let's just bring someone in so we can pass this off to versus as you described, I love how you described that. It's a
yeah,
knitting. It's
yeah.
attaching to each other.
No, and you could go farther with it. I mean, knitting, I know a little bit about it. My mom actually taught me to knit when I was a little kid. I
Ah!
don't do it anymore, but we did that. But there's a structure, there's a pattern, um, and that's very much like what you're trying to enable when you work with a group that's starting out with integrated care. You want them to build a structure, to develop a patterned way of working that brings together, the threads of what they're doing to make it a whole thing that hangs together, doesn't come apart.
What a freaking metaphor. Let's go. Like again, I haven't heard that metaphor before. And that is
Yeah,
brilliant beyond brilliant. That was awesome, Jonas.
yeah.
Let me ask you this. Looking back, like here's this moment right now that you and I are sharing. I'm so grateful for this because I this has been an interesting week for me, and there's been a lot of ups and downs. I just feel very inspired right now, just even having this conversation. So my gratitude for you for it. So in this moment right now, looking back on the decades that you've dedicated to, where does your mind go? Is like, what are you most proud of? Like, what's the thing that you think back on? It's like, this is something that I'm just extremely, extremely proud of. This is something that comes to mind that, still, when I think about those moments, when I think about those things, what we did accomplish, where's your mind go?
The first thing that comes to mind is how empowering this is for the medical clinicians, the pediatricians that we work with. I could tell you so many ways that they describe this in such powerful terms. I not, just about a month ago, I was sitting talking with one of the pediatricians, and he said, integrated care is probably the most important thing that's happened to pediatrics since vaccines.
What are we talking
Really?
about? What are we talking about? Right?
Since vaccines, I mean, there's a lot of important things that have happened in pediatric medicine since a vaccine was invented, and you're saying this is the most important thing. And he said, yeah, because so much of the lives of our, the patients and families we care for, have to do with this. And I didn't know how to do this before. I wasn't trained to do this. I learned how to do that. I feel like I have some, intuitive sense of how to do this, but this has just empowered me so much. And I hear that story over and over. I would never go back to working without a behavioral health clinician as part of my practice. Is the common thing that people say. But how transformative it is, and how uh, how how comforting it is to feel like they can readily, you know, involve somebody on their care team in the moment in the care of this family, and not have to go through this process of, making a referral, having families have to go out in the world and track down, you know how hard it is, to find a clinician these days out in the, community. But to give a pediatrician the ability to have this person on their team to respond right away, to help the families and help them, to somebody to run cases by and get some advice, even if it's not meeting the family, just providing that consultative guidance to the clinical team. I think that's the most exciting thing about what we did. I mean, obviously the stories about how families were helped, was enormously powerful, but every pediatrician touches hundreds or thousands of lives, so to empower those clinicians in this way was enormously gratifying and exciting.
And Jonas, I appreciate that. Oh God, that is so freaking cool. And as you're saying, like, if you're not there, if your team's not there, or whatever, like, does those questions even get asked by the pediatrician? Because if I was a pediatrician, I'd be like, listen, like, I don't even want to bring this up. because like I'm not going to be able to get them in anywhere. I don't feel confident in my skill set to be able to deliver. And it's like these questions don't like, again, going back to almost like the motor vehicle accident. It's like maybe there's some awareness that we should be having, but it's like, what happens if this comes up, right? It's like you being there now. It's like there's
Yeah.
confidence now in the pediatrician be like, oh, I can bring this up.
To
We'll be.
your Yeah, sorry, to your point, I had a a managing partner tell me when I first went to meet with him when that practice was first starting out. He said, "Yeah, you know, I think some of the pediatricians here avoid asking those questions because if somebody says yes, I'm struggling with that, they don't know what to do and they feel helpless, and so they just don't ask because they don't want to feel helpless, and obviously that's not good care, you know."
That is no, that is not good
Yeah.
care.
So he had this moment of realization, like, wow, we really got to change what we're doing here. We got to ask these questions and, get everybody comfortable doing that.
Jonas, you're getting me hyped right now. So let me ask you this. As we were talking about, you're embarking on this next chapter of your journey, and again, similar to what we're talking about with Chris Hunter, as he was embarking on this next chapter of his journey, and really having a value and a want to support other people, and help guide people that are on missions and provide mentorship and consulting and different things. So this is a plug for people that are watching this. Video that Jonas, we can't overstate your expertise in this, and so to reach out to you about this next stage, about the consulting and the mentorship. Let me ask you this: what are you looking forward to in this next chapter, as you kind of take, as we talk about this leap into this next realm? What are you looking forward to?
Yeah. Well, again, what I come right back to is that, you know, being able to teach and coach, empower, medical clinicians to feel comfortable doing this. They're forced to do it. I mean, especially in pediatrics, that's where families turn to their pediatrician when their child's struggling, with their emotions or behavior, and preparing pediatricians to be better able to sort of help those families when they come, is really exciting to me. um, uh, I spent a decade uh, building, along with a lot of other people. I mean, it wasn't just me for sure, but we spent a decade, building a big program with a lot of components. It's in a strong, mature state, and it felt like to me that this was a time to sort of make a change for myself and try to take that knowledge and expertise I had to other places. I mean, I was fortunate to work in a health system that had where I had a ton of support, a lot of resources, and I know that everybody out there in the world doesn't have that. And so I'm hoping to take that knowledge and expertise and bring it to a broader audience of people that may not be part of a health system that is able to help them in the way that the health system I was part of was able to do for the members. So whether that's through coaching or training or consulting, um, you know that opportunity, I guess, the last decade has really ignited this fire within
Yeah,
me about
yeah.
and I know you share that passion for integrated care. I mean, it's I'm deep in my career and it's the most exciting thing I've done in my career. I mean, the opportunity is just enormous. Again, that opportunity to sort of be involved with families at the very beginning, when they're starting to struggle, and not wait for it to become something where they end up having to go see somebody in the community when there's a full-blown problem. I mean, that's exciting, to prepare clinicians and primary care teams to be able to, uh, to work with the families that they care for in that way. I guess that's uh,
Jonas, and the thing that my mind said as you were going through this, clearly, what's the best predictor of future behavior, right, is past behavior. And when we talk about the career and the successes and stuff, I can't wait to see what this next chapter is for you, because it's going to be brilliant. And I love how you said, like, even at this point in the career, it's like the passion and the fire and the inspiration is, there, right? And it's because of seeing the work. And so I hope people that are watching this, again, if you have questions, if you're starting a new system, if it's peds, if it's even outside, it seems like outside of even primary care, but especially like reach out to Jonas, get this wisdom, get this knowledge, to be able to pass on and to inspire this next ripple of who the hell knows? Maybe it's 1,000 BHCs that a
Yeah.
system's going to have.
Yeah. Yeah. And this is an approach that I think fits well. Obviously I've spent a decade, doing this in pediatrics, but there's a lot of this going on in adult medicine and in specialty medical care. I mean, there's lots of places where, bringing together mental health and medicine, can happen in service of, benefiting families and empowering clinicians. So I don't know what exactly, where my ship's going to sail next, but as I've approached every sort of juncture in my career, I'm just being really open-minded about what that might be, and not thinking there's a straight line to where I want to go. Just being open to whatever opportunities may present themselves, getting out there and talking to people and letting them know about the experience and expertise I have, and I'm willing to help. I want to help people. I want to ignite this passion for integrated care and the good that it can do for, kids, families, adults, in whatever way. I mean, it is exciting. And I know, I've heard you say this, that, it helped you save your career before you even knew it needed to be
Amen.
saved, something like that,
Yeah.
and that was inspiring to me, and that's an interesting thought. And, that's what I want to do. I want to get people, excited and give them the know-how of how to do this, because it's so powerful in so many ways.
Jonas, I cannot express my gratitude enough. And without question, as soon as you said it the first time, my mind was like, oh, that's going to be the title of this be open, right? Like be open to whatever the universe is bringing and different kind of things. I'm just excited for you. And as I said, this has been a healing conversation for me and just reignited my inspiration. So again, selfishly, like, hey, this is this is such a win for me, and I'm so glad I'm able to do this.
And I have one other thought about it, if you don't mind.
Please, please.
One thing I've observed, and I think it's true across the country. Um, I think the majority, and maybe the vast majority of mental health clinicians are not trained to think about working in primary care. I think that's a place where, I'd like to have, some impact and, influence in the future. The primary care mental health workforce, exists, but it's not evolved and developed as it could be. And, we have 100 something clinicians, in the network, but very few of them had done any sort of primary care work before. Out of 100 clinicians, I think there are, one or two that had any sort of formal training, prior to taking a job in the network. So we were really retraining people in a lot of ways to think and work in a primary care way. And that, I think, is, that's where I think our field, there's a lot of growth opportunity. When I think about what's needed, it's the workforce development, and it, the foundations of how to intervene as a mental health professional are the same, but how you go about the day-to-day work and making it happen, and the way you approach it's very different than if you're working in a mental health only sort of environment. And that was the other thought that I had about, the
Hell
future.
yeah, man.
Yeah.
And again, this is the thing. Talk about a track record, as you said, like just a few, maybe 1 or 2% of the people that came in. It's like, and I think that's another good reminder to folks watching this that if you're a director of a program, it's most likely going to be on you to train people coming in, right? Like the idea that someone's going to come in with training or even good training, whatever we want to say that, like it might be low. So I love that statement, focusing on workforce development and be able to assist that. That's cool.
Yeah. Yeah.
Well, Jonas, again, my gratitude for today, and thank you not only just for obviously all the contributions and all the different things, the career. If anybody's ever talked to Jonas at a conference or ran into, like, you're just a great human and a very enjoyable person. So my gratitude for getting to know you and spending some time even this morning, man. I really appreciate it.
No, it's been a pleasure, David. It's always exciting to talk to you. I love the energy you bring to this. I love the questions you asked me today. I hope this interview we did, the segment you produced from this inspires other people,
Hmm.
um, and I know it does. I know that people watch this and get inspired by it. And, if there's opportunities to, help contribute to that inspiration and growth and development. You know, I'd love to be a part of that in any place at any time.
Let's go. Let's go. Well, thank you. As always, people watching this, reach out. Jonas, are you okay if I put your email into the description of this video? Would that be okay? Or do you
That
want,
would absolutely,
okay.
absolutely.
So if people want to reach out, the email will be in the description of this video. But Jonas, again, I can't wait to talk to you again. But thank you for today. Awesome job. That was great.
David, thank you very much.